Perfect. Thank you, Abby. Good afternoon to everyone here. Thank you for being with us today, and happy Summit Day. My name is Aaliyah Farrard. I'm the Alliance's Hunger Free Communities Associate, and I'm delighted to welcome you to our session celebrating the 2024 Zero Hunger Grant recipients. In this workshop, you'll hear updates from 4 of the winners of the first grant cycle, each of whom have created powerful approaches to fighting hunger within their communities. Before we dive in, I want to give a little bit of context about the program. The Zero Hunger Grant program was launched in 2023 as part of a broader initiative by the Alliance. Through listening and collaboration, it was recognized that many of our HFC partners were facing significant financial challenges, especially as funding sources declined post-COVID. So out of that need and commitment, the Zero Hunger Grant was established to support community-driven, multi-sector approaches to ending hunger, approaches deeply rooted in racial equity and community engagement. Unlike traditional funding sources that may be distributed to support direct services, the Zero Hunger Grant is uniquely focused on capacity building, aiming to consider root causes and strengthen organizations to create lasting systemic change. Some examples of capacity building initiatives may look like hosting community convenings to develop hunger-free plans, conducting needs assessments, enhancing data systems, or training teams to address racial equity goals. But by prioritizing capacity building over direct services and tackling those root causes of hunger, the grant empowers organizations to build a foundation for sustainable progress. And we believe this approach strengthens local resilience and creates long-term solutions that move beyond temporary relief. This year, the Zero Hunger Grant Program was able to provide up to $10,000 per award, and we were able to secure $50,000 in its inaugural year to distribute to the 5 outstanding organizations here with us today, including Second Harvest Food Bank of Northeast Tennessee, Community Food Advocates, Livingston County of United Way, Arizona Food Bank Network, and San Diego Hunger Coalition. Congratulations to you all again. The selection process for the grant was both rigorous and inclusive. We received 14 applications from dedicated HFCs across the country, each incredibly eager to advance their local initiatives. In keeping with our commitment to transparency and collaboration, the process included a peer review component where each applicant scored another application. So I would like to extend a heartfelt thank you to everyone involved in this process, including our volunteer reviewers, all of the applicants and supporters, our HFC advisors, and Alliance staff. Your insights and dedication were invaluable in shaping our decisions and ensuring that this initiative reflects the collective strength and diversity of our HFC network. So our speakers here today will have time to share their work, progress, and future plans with you all. Please feel free to write your questions in the chat. I'll direct them to our panelists at the end, depending on time. And with that, I'll pass it to our first presenter, Isabel Loga from Arizona Food Bank Network. Take it away, Isabel.
Great. I'm Isabel Loga from the Arizona Food Bank Network, and I'm excited to be a grant recipient as the Arizona Food Bank Network and to be able to align with the mission that the grant had in this project. So I'm going to talk about a little bit how this project came to be, and then into where we are now and where we're going to go. So as titled, this project was centered on better understanding LGBTQ food insecurity in Arizona. And I'll go a little bit starting into the Arizona Food Bank in general to see how this project came out of our mission as well. So we're a coalition of 5 regional food banks and almost 1,000 pantries and agencies, and we all work together to address hunger in Arizona. Together, the network feeds 1 million people each year in 15 counties of Arizona. We are not a food banks ourselves, but we support the network while fostering collaboration. So our mission is to develop solutions to end hunger through food banking, public policy, and innovation. And innovation is the department that I work in, where this project came out of. And our vision is a hunger-free Arizona. So I want to go a little bit into the acronym, and I'm going to be shortening it as I speak to LGBTQ, but this is a little bit of the background of the population that we're serving in this project. So we have Native Two-Spirit population, lesbian, gay, bisexual, trans, questioning and queer, intersex, asexual, and pansexual. So that is some of what the spectrum of LGBTQIA acronym means. And I'll be using LGBTQ for the remainder of the presentation. So we're talking about LGBTQ food insecurity nationally is where this project came out as. We wanted to better understand what does that look like for Arizona? And we started seeing these statistics as we all see in our work. And so we were wondering, how does that look like for us? And so I wanted to go into the national statistics that made us kind of pay attention to this population and start this project. So Some are, I'll go into a few of them. One of the ones that we see a lot is 20% of LGBTQ youth experience hunger every month. That was a statistic that definitely helped us phrase a little bit of this project to focus on understanding more of LGBTQ youth's experiences with hunger. LGBTQ folks are 6 times more likely than non-LGBTQ folks to not have enough money for food or for themselves or for their families. So we also talked to a group of people to better understand the family situation with food as well. And food insufficiency was more common among LGBTQ than non-LGBTQ, 12.7 for LGBTQ versus 7%. And that was kind of during a pandemic time as well. And so these statistics came out of the Williams Institute study from 2021, and there were some 2022 statistics in there as well. So after we saw this, we said, what does this look like for Arizona? So we started, I'll go back and kind of talk about the why behind the statistics as well. So that's sometimes a question I often get with that. And marginalized communities, including the LGBTQ population, often face unique challenges that contribute to disparities in access to resources, including food. For this community specifically, they may belong to multiple marginalized groups. And that might be, some of those groups may be with their sexual orientation, gender identity, race, ethnicity, health, socioeconomic status. And the meeting and overlapping of these identities on top of each other can compound challenges that they face, making it essential to consider the diverse perspectives and needs within this specific community. LGBTQ individuals often experience systemic discrimination and social stigma. There's some history with that as well. This discrimination can manifest in various forms, including limiting employment opportunities, unequal access to healthcare, and housing insecurity. These factors contribute to economic instability, and as we know, that can lead to food insecurity. Food insecurity is also closely linked to health outcomes, which we've already talked today in other sessions very heavily as well. And inadequate access to nutrition foods exacerbates these issues. This came out a lot in our focus groups as well. Unable to take medication because of not having food, which just adds on to exacerbating health issues. Many individuals within the LGBTQ community may face silence and invisibility when it comes to their specific challenges, and many programs that are developed to address food insecurity may have barriers specifically for this population and not considering the diverse lives of the LGBTQ community, the diverse family structures and pronouns and such, for example, and genders. And this can bring challenges when applying for programs. So we wanted to look at what this looked like for Arizona. We started by talking to 43 organizations that are working in the LGBTQ community of Arizona. We asked, are you seeing food insecurity in your community? Many people answered yes, 33 of them. And then there was about 10 people who said, we're not really sure, we're not tracking that. But overwhelmingly, people were saying, we're seeing this, we can't pinpoint the reason why, we want to do something about it, and we need some data to start that. So we heard that, and that's when we applied for the grant and were able to start this project. And one of the goals on the grant, which was mentioned, is to have a deeper understanding of hunger in our communities. And so when I look at this map, these were all the counties who reported seeing food insecurity among this population. So we needed to deeper understand why, so that we can have some systemic rooted solutions to work on improving food access for this population. So we did a needs assessment. We're doing a survey, we're doing a focus group, and we're in the midst of this right now. I wanted to provide an update on where we're at with the project. So we attended 10 Pride festivals, which definitely met and we're actually doing another one. I can say 11 on Saturday. I'm attending our last one that we have here in Arizona, where we shared food resources and gathered survey responses and had conversations with community members. We formed a committee of 25 organizations working in this community that are dedicated to improving food insecurity for the community. We exceeded our survey response goal. We had a goal of 500 responses and have exceeded that to this point. We still have about a month and a half left. We are ending the survey in December, at the end of the year, December 31st, and are happy to say that we've already exceeded our goal. Right now, we're working on making sure we're reaching data for the rural counties, and we also have a rural focus group coming up, which I'll talk about a little bit later. So far, our goal was to hold 3 focus groups, and that's how we budgeted within the grant. And we were able to stretch that money, and that's what I'm currently working on, is hoping that we can get 2 more and have 5 focus groups. So far we've held a senior focus group, a young adult focus group struggling with housing, and we did a 2-spirit focus group just on Sunday. And all of those have been really enlightening and successful. And we are excited to be synthesizing everything that we learned from that. Up next, as I mentioned, the survey closes on December 31st. We have upcoming a rural focus group. We're recruiting from these rural counties, and we're going to have a discussion together to talk about what rural food insecurity looks like for this group. And we're going to do a youth focus group in a middle school, and we're working on planning those. We're going to be working on, in the new year, come January, synthesizing the data and publishing the report. I already have a list of partners and organizations in the state who are looking forward to these results. And the committee that I had mentioned before, we're going to convene, we're going to go through all the data, and we're going to start building projects and programs. Food pantries that are specific for this community that once existed in Arizona and no longer are, and we want to revive some of that, for example, and partnering with other health organizations as well. So there's lots of stirrings that are already happening, and we're hoping that this data will just lift that up, and we'll be using the committee as well to go on with that. And that's all I have for you today. And I have my email here if you have any questions or would like to know more about the program. And if you'd like to see the report later, if we have any Arizonans in the group, feel free to take down my email. Thanks.
So much, Isabel. That was great. Next up, we have Liz Ackles from Community Food Advocates. Take it away, Liz.
Hey, thank you. I'm putting on a timer to keep track of myself. Thank you for having me here. I'm Liz Ackles, the Executive Director of Community Food Advocates in New York City. And we define ourselves as a high impact public policy change organization, and we do that work through coalition building and organizing. And we think that the government has a primary and essential role in addressing hunger and poverty. And so around the supermarket access project that I'm going to be talking about, that's where we focus our efforts. In New York City, as in other places throughout the country, access to full service supermarkets is really varies by community. And it is something that most people agree that it's an essential piece. It's not the end all be all, but an essential piece to a healthy food ecosystem in any neighborhood. And this has been a long entrenched problem that the city has taken action. I'll talk a little bit about that, but really with very little movement. So we are not economic development people or grocery store with a whole lot of grocery store knowledge. But what we do is we identify challenges, look at big vision, and pull together folks in coalition to be able to assert their experience and expertise towards a very directed policy goal. So just for like, this was actually surprising. The city did a research project called New York City Speaks and looked at, among other things, what are the kind of health services people want to see in their communities. And the top leading one is grocery stores and farmers markets. So it just confirmed what we had anticipated and had been hearing from an important confirmation. So if you can go on to the next slide. So we've been looking at this for a while and trying to figure out, it's a monster of a problem. How do we even think about that? Something that's a citywide approach that's bold and different and also scalable to, also tailorable to different neighborhoods. So first thing we had to do is do an updated look at where things are. And just to give a quick number, and the thing to really look at is these city target ratios. In 2009, this New York City did an analysis of what the ideal resident to supermarket square footage ratio should be, and it was 30,000 square feet per 10,000 people. At that point, it was actually 15,000 square feet for every 10,000 people. And out of a response to that, the city initiated something called the Fresh Program, which was to incentivize through tax credits and zoning variances supermarkets to enter the New York City market. But that was in 2009. It's 15 years later. There are now about 30 some odd stores. That's not scalable. And we've only gone from 15,000 square feet every 10,000 residents to 17,500. So we did a big analysis trying to figure out what are the policy pillars that are needed to really address this on a full scale. And we did this by analyzing community needs, operator challenges. Supermarkets have, from what I've learned, have very slim profit margins, opportunities within New York City has a lot of old buildings, so sometimes space limitations. But we know, particularly in areas that are being gentrified, like where folks have said, oh, it's impossible to add new supermarkets, that in gentrifying neighborhoods, food infrastructure gets invested in, but with significantly more geared towards people who are newer and have more resources. Can you go to the next slide? Oh boy. Okay. So just saying some industry barriers are real estate, operating costs, location decisions, and the ability of operators to, in other words, a lot of operators don't have a misconception that there isn't enough money in low-income communities to open businesses and keep them going. So that's some of the work that we're looking to do. I realize I have very short time left. So we pulled together community organizations as a starting point, folks that are working on cooperatives, academics, some public financing people, and we're beginning to work with tenant leaders in public housing throughout the city to dig deeper issues. So there's a lot more in that. Can you go to the next slide? We identified these 6 policy pillars. I'm very happy to share any of this with anyone. The reports: deepen and expand financing tools, tax breaks are not enough, build operator capacity. In the development process, they assess how many more school seats are needed when there's a big development going up. They don't do anything comparable when it comes to food access. Support alternative ownership models, including co-ops. Identify quality and affordability measures to really get to that and assess that, and ensure that community needs and community benefits are clear and explicit requirements when private businesses get money to open up stores. So those are the 6 pillars. There's a lot of detail, a lot more work to be done there. We do have great interest from the New York City Council Speaker's Office as a starting point in this whole issue, and as a starting point with there might be an opportunity to develop something more significant in terms of low interest loans and low and no interest loans and grants for supermarkets looking to open up in low income neighborhoods. I'm going to stop there.
Thank you so much, Liz. Next up from San Diego Hunger Coalition, we have Alondra Alvarado.
Thank you, everyone. I'm very excited to be here, and we are very honored to be the recipients of this Zero Hunger grant. So the San Diego Hunger Coalition is a nonprofit. We're a backbone organization, which means that we don't provide direct services to residents. We provide services and information and resources to the community-based organizations and different stakeholders, including elected officials' offices that are working directly with the community. Our mission is that we partner to create equitable access to food assistance in San Diego County through research, education, and advocacy. And our vision is that every individual has access to 3 culturally appropriate and nutritious meals every day. So the way that we do this is we call it the hunger-free model, which is research and data. We have developed a methodology to measure the nutrition security in San Diego County. We developed a methodology to also measure the meal gap of the meals, the missing meals that we have in San Diego County. And we also have information on SNAP, it's known as CalFresh in California, to CalFresh participation in San Diego County. This information is available by zip code. It's also available by electoral district. And with this information, electoral district, we also do policy and advocacy. Every time that we meet with an elected official, we bring specific data to their district so they can see how it's compared to the rest of the county. We also do education and outreach. We do training and technical assistance to community-based organizations. We escalate cases to the county of wrongfully denied applications. So the work that, so you can have a better understanding of how San Diego County it's formed. Like in San Diego, we have a little bit above 3 million people that are living here. We estimate that a little bit above 800,000 people in San Diego County is nutrition insecure. As in March of 2024, 1 in 4 people are nutrition insecure, including nearly 1 in 3 children, 1 in 4 older adults. And I'm pretty sure this is not news to anyone. Nutrition insecurity also disproportionately impacts communities of color. This is we release data quarterly. We are in the last draft of 2024 issue brief, which include a more a more extensive analysis of the situation in San Diego County and the latest data that we have available. So you can you can see some visualizations of the information that we share for free to the partners that we have. They use this data so they can strategically allocate their resources and programs in the county. So if some of the food banks are thinking about opening a new food distribution point, or they are looking into, or like other senior meals programs, they are thinking about expanding their distribution routes, they can use some of the information that we have. What we have noticed and what we have learned in our through our research is that the low-hanging fruit in San Diego is to end hunger in San Diego is SNAP. So 35%, we estimate that 35% of the people that qualifies for CalFresh are not enrolled in San Diego County, which is a little bit above 200,000 people that might qualify. So, and as you can see in this map, we go all the way from the border with Tijuana and some areas close to Mexicali, all the way up to the border with Orange County, which is LA area. So you can see here the participation rates. The darkest points are the places where we estimate that there's more people that qualify for CalFresh, but they are not enrolled. With the grant goals, one of the things that we wanted to increase is the number of households enrolled in CalFresh. We do this through the network of partners that we have, which is probably around 500 partners that we have between elected officials, community-based organizations, school districts, churches and other like religious organizations. Also, to increase the number of households that San Diego Hunger Coalition helped to overturn wrongfully denied coverage applications or SNAP, and the number of trained hunger-free navigators. This is a program that we have in one of the trainings that we provide. It's free and available to all the anyone who wants to join. This is an overview of all the food assistance programs available in San Diego County and how to reach out and how to have access to these programs. The results of the first 3 quarters of 2024, this year was particularly interesting. Unfortunately, interesting is because in January 20, we had a flooding, very affected a lot of families in San Diego. So we got approved for disaster coverage. What we did, we were the only organization in San Diego that put together free trainings and toolkits for everyone to know how to access to these programs. Caseworkers, staffers, school districts join our trainings, and they use this information to spread the word and support the families, the victims of the floodings. And we were able to recover $5.7 million in food benefits, benefiting about 500,000 people in the county. Sunbug Summer EBT is the other new program that we had in California as well. Well, the federal program, but California participated in this. The first year of this summer, we estimate, we haven't received official numbers, but this is the estimate that we were able to support in the issuances of $17.1 million, benefiting 163,000 children. The coverage applications that we did this year, or the first 3 quarters of this year, is that we have pre-screened 20,000 households, submitted almost 5,000 households, approved 2,554 households, and recertified 1,600 households. We also have trained so far 214 navigators that are supporting people in the community to help them to have access, or to spread the word about the information. We also have a lot of available resources. You can go, because of the time, I didn't include them here, but you can go to our website, sdhunger.org, and you can go have access to the resources. We have some of the flyers, our food assistance flyer, which is a list of all the food assistance programs available in San Diego County. And that one is available in 13 different languages. Our trainings are available in English and Spanish, since we have a high population of Spanish speakers in this county, because we have a lot of immigrant families or people that crosses the border. What we have coming up for our organization is that right now the county here is the one that manages the coverage applications, the SNAP applications, and then the situation with the county right now is that, unfortunately, the denied applications are up to 50%. So we are increasing our advocacy work, and right now we are working directly with the county to create nutrition security a priority with the board of supervisors. So that's and we are coordinating our group of 30 organizations to do advocacy, to send letters, to talk with their elected officials, to make sure that everyone that qualifies has access and participates in this program. We are also trying to expand our research. We have been reached out by some of the Baja California state, which is the state that's bordered with California. They also want to replicate our methodology in Tijuana, because we have a lot of San Isidro and Tijuana is the most visited border, or cross border in the world. So we have a large population of people that work in San Diego and live in Tijuana. So this and a lot of people that come to San Diego to go to school, but they live in Tijuana. So we are trying to expand the vision to more of our regional information. And then the next thing that we're coming up, if you want to learn more about what we do, we are having our 6th annual State of Hunger. The virtual option is free. You can register. It's November 21st, 3 p.m. Pacific time. So if you want to learn more about what we do, please join us next week, and as we are celebrating also our 50th anniversary. And then that's my information in case you have any more questions, or if there's anything else that I can answer for you. Thank you.
Thank you so much, Alondra. That was great. And our last presenter for this session is going to be Patricia McKesson from Second Harvest Food Bank of Northeast Tennessee.
Okay, thank you. Thank you so much for having us today and for the opportunity to for your grant your grant provides. Again, my name is Patricia McKesson with Second Harvest Food Bank here of Northeast Tennessee. Our mission here is to feed the hungry in Northeast Tennessee by securing and distributing food and engaging the community in the fight to end hunger through regional partnerships, programs, and education. That next slide will give you that. Thank you. And now, Second Harvest Food Bank is a member of the Feeding America family. That is the nation's largest food bank network. And we've led this effort to end hunger in Northeast Tennessee since 1986. We are the only food bank that's serving the 8 county region that we serve. Um, and those counties are listed there. In the fiscal year of 2023, the food bank provided 10.8 million meals to people in need in the 8 county region. Over 40,000 individuals each month are served through the food bank's partner agencies and direct service programs. Now, a Second Harvest Food Bank of Northeast Tennessee, the staff and the board of directors are dedicated to helping provide food assistance and help stabilize the lives in the 8 county regions for years to come. The food bank seeks innovative ways to improve operation and nutritional content for the food that's distributed. Through our surveys and information provided, the next slide will show that the national food insecurity rate we found at 13.5%. And alarmingly, people of color, in the next slide shows people in color in Northeast Tennessee experience that food insecurity rate at a rate that's almost, well, actually, it's more than double than that of the white non-Hispanic neighbors. So at this point, we looked out of the 8 counties that we serve, we looked towards the larger counties in the area. The next slide will show the food insecurity by county and race, where you will see that even the white race does show over the 13.5 national average. But when we look into the Black and Latino communities, those numbers more than double. So these statistics are provided by Feeding America. So one of our many accomplishments through this grant is to have regular meetings in the heart of the communities that we serve. We were working to find what we can do differently to help ease the disproportionate hunger rate of our Black and Brown neighbors. So we wanted to find out the why. Why are there such disparities in the numbers? Are neighbors not using the resources that are there? Is there a problem with transportation or in the historically Black and Brown communities, the churches that are there? Do they not have the resources and to become agencies and to distribute the food? Um, was there a stigma of getting help from the different agencies or bad experiences that neighbors have faced in the past with other pantries? Our question was what? Why is this happening? And what can we do different to solve this problem? So we found that education is key. So in our meetings, we incorporated the use of the racial wealth gap learning simulation by Bread for the World, and that's on slide 7. The next slide, please. In that simulation, we talked about the policies that have created systemic racism and how that has widened the gap of the wealth and hindered equality in resources. The objective is to educate neighbors and so that we can level the playing fields for racial equality and food insecurity. What we learned with that simulation and through those sessions that we needed the call to action was better received by the members of the community. Our initial goal was to reach out to the leaders of the community, but the people that were in the fight, they were ready to start on these sessions to find the answers. And we found that there was definitely a stigma associated with visiting food distributions in your own community where people may know you. So we're working on deactivating that stigma. We did find indeed that there are a lack of funds to support and sustain food pantries in the historically Black and Brown neighborhoods, as well as consistent help for able-bodied volunteers to assist with the distributions. Um, we did find that there was also an unmet need in the Latino or Hispanic communities for food. And not only that, but getting food that that is culturally sensitive as well, such as the masa flour or things that they use in particular. So these sessions gave us great insight as to how we can accomplish the goals and alignment that the Zero Hunger has given us. With that, we identify the why behind the racial inequality in our region. We are looking to educate the community on the policies that historically have led to this systematic inequality. We want to ensure that the food bank is applying a racial equity lens when we're working to end hunger in our region. We want to reach out, uplift, and inspire our community leaders and members. We are seeing a better response now that we do have some bases to go on, and these leaders that were reluctantly getting involved before are coming on board to help find solutions to these problems. So we're incorporating the lessons learned into our new 5-year strategic plan here at the food bank, and we look to continue this good work. Thank you so much.